Dear smart pharmacists, dear colleagues, in this very unusual and unpredictable time of pandemic, we would like to express our support and connect with all of you all over the world.
We'd also like to thank you for your dedicated efforts to serve the patients at the front line. We know that the coronavirus pandemic has significantly changed your priorities in everyday work with patients, both in hospitals and in community pharmacies.
Global warnings are pointing to social distancing, disinfection, use of paracetamol and immunity boosters, but especially since we cannot provide our usual point of care and other services to our chronic patients because of safety concerns, we all feel there is not enough opportunities and time for patient care activities.
In the same time, our professional organizations, World Health Organization and epidemiologic reports are warning us, as well as sending those messages to the public, that our chronic patients are facing much higher risk of complications, severe symptoms, and even death as a consequence of viral COVID-19 infection. Therefore, there is no doubt our counseling and patient care must keep the highest priority in our daily schedule.
In our Smart Pharmacist program, we have refreshed our knowledge, skills and motivation to provide better care, especially to chronic patients. Asthma and COPD, diabetes, hypertension, obesity and smoking are the main contributing factors to the higher risk situations.
Adherence, communication, achieving the targets can truly help our patients if they are monitored and motivated by you, smart pharmacists. Remember, not only education, but its application to practice is essential to the difference and impact that our program makes to the profession and patients.
Why diabetes? Both insulin resistance and diabetes are characterized as pro-inflammatory conditions, and concentrations of inflammatory markers are increased. Changes in the secretion of plasmin, interferon and cytokines lead to higher risk of severe inflammatory reactions and more severe symptoms of inflammation. Furthermore, viral infection will increase blood glucose levels, and there is an increased risk of ketoacidosis due to changes in the pH of body liquids. Patients with diabetes may need to change their insulin dose if they become infected with COVID virus, and metformin and SGLT2 inhibitors may be replaced by other medicines. Glucose levels should be kept within the reference range and checked more frequently, with particular care for hypoglycemia in diseased patients living in isolation.
When it comes to the respiratory system, it's extremely important to focus on the comprehensive care of patients with asthma, allergy, and chronic pulmonary disease. Since the coronavirus attacks the entire respiratory system and progresses extremely rapidly, with patients most often dying of acute respiratory syndrome, it is clear that lung capacity should be taken into account and that bronchoconstriction situations should be minimized. Regular use of long-acting bronchodilators and inhaled corticosteroids, as well as anti-allergy therapy if hypersensitivity is present, saves lives and dramatically reduces the risk of a fatal outcome of the coronavirus infection.
Whether dispensing medication just through a small window or at a distance, let us show patients the inhalation technique of their asthma and COPD medicines, or refer them to information sources and displays online to safely administer their medication. Encourage them to complete the asthma control test and record or report any changes to the peak flow meter values or frequency of salbutamol use.
Dear fellow smart pharmacists, let us not fall into the stereotype that suggests that now is not the time to provide patient services. Let us use our time carefully and responsibly when meeting patients with chronic diseases.
Let us be aware that we might be the only healthcare professionals who will receive a patient these days without any restrictions. Let us ask them about the outcome of the treatments, about drug-related problems. Let us warn them about adherence and try to achieve the set therapeutic goals with them to keep chronic diseases under control. Perhaps talking to some of you will be crucial to the status, severity of symptoms, and the life of a patient who has the coronavirus. Just go bravely into counseling because we care for our patients.
We are confident that with your engagement and the dedication of your leaders, our Smart Pharmacist program will not only continue, but grow and expand rapidly, as the context of our practice is demanding us to be engaged and smart. Try to document what you can, but please never be tired of counseling, educating, and applying your learning into practice.
We will support you. We are proud of you. And we will keep planning our future Smart Pharmacist meetings as soon as the situation permits.
Stay safe, stay smart. All the best to you and your pharmacy teams. Yours truly, Ariana and Mike.